Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnekins, and joining us this afternoon is Angela Jacobson. She's Director of Emergency Preparedness with Advent Health of Durand, and we're going to get an update on the COVID-19 vaccination program. When we recorded this on Monday, the 25th, we just started the next phase, the phase 1B, and Angela, you do have vaccine available at Advent Health, correct?
Yes, we do. We have 400 available that we got allotted from the state of Wisconsin.
Wow. Now, last time it was only 100, so that's quite the increase.
Yep. They say they have a rhyme and reason for every request, but we were blessed this time to get 400 for 1B. And 1B opened up for anybody over the age of 65.
And now I know that they're still kind of waiting to say, who else is on there, like for the I guess essential workers or that sort of thing. The state is, correct?
The state is. They were supposed to have the recommendations out. It's the SDMAC committee, and that's the State Disaster Medical Advisory Committee. Sorry. They were supposed to have the recommendations out Friday, but they still haven't. I've been checking all day today, and they haven't posted any of their other recommendations for 1B.
Okay, and then once we get those, then those folks also would be included. So now for this, what this means, if I remember the last time we talked, so you received 400 doses today. That means there's already 400 second doses guaranteed.
Allotted for us to come. Yep. Once you get your first dose, so call either of the clinics and get scheduled. And then once you get your first dose, we'll give you an appointment card to come right back in 28 days to get your second dose.
Okay. And so now, and then now, like, when do you place your orders for vaccine? I never really asked that. Do you do that like on a Monday, or when do you have to do that?
Every Tuesday by 5 o'clock. That's why I've been watching for the recommendations, because if they open up the recommendations for anybody with healthcare conditions or all the teachers or everybody, then I would try to get 1,000 more. But if they just keep it to under 65, then I would request maybe 200 more. I work together with Heidi in the health department and Heike pharmacy, so we all see what we are getting in the community. Okay. Just so we can vaccinate as many people as we can.
So now then that's, I think, a good point. While Advent Health has received 400, Pepin County Health Department's received some, and Heike Pharmacy has received from. That's separate from your 400, right?
That is separate than our 400.
Wow. Okay.
So yeah, our county got very blessed this week.
I guess it did. So again, folks, then all they need to do is just call either clinic and then get that appointment set up. And I'm assuming that you could be taking appointments Tuesday, Wednesday, Thursday, Friday, nonstop, right?
Wednesday, Thursday, and Friday. Thursday night, we plan on going until 7, Wednesday until 3, and Friday until maybe 4.
Okay.
We're going to wait for after school to get out so then we can give them to people.
Talking with Angela Jacobson, Director of Emergency Preparedness for Advent Health. Now, Angela, in a prior interview, you talked about that Advent Health was the vaccinator for Buffalo County too. Now, for the vaccine that you received, this 400, is this kind of like also for Buffalo County, or do you do something separate for them?
No, that was to try to vaccinate 1A, group 1A, where all the frontline healthcare workers, and we did help out Buffalo County with that in the beginning until they established other networks to help them out as well. But if our patients live in Buffalo County, or if they want to get in on this, we're not turning anyone away. If you live in the state of Wisconsin, we cannot take people from other states.
Okay, so
you get your state allotment.
Sure. So if there's folks that, and that's actually probably a very good point. There might be folks living in O'Galley that are patients at the clinic, and it's like they're included in this, right?
Oh yeah, they're included.
Okay. And again, all you have to do is give Angela, or give the hospital or one of the clinics a call as well. Angela, as we move forward, now granted, you got 400 doses, so we're going to be moving along pretty quickly, at least potentially, but statewide, there's like 700,000 people 65 and over. If we're only getting 70,000 doses a week for a whole state, I don't have to be, a math wizard to figure out that that's 10 weeks before we would get everybody done. I mean, is is that a concern among folks like yourself in the healthcare
I
industry?
don't know, because larger hospitals and larger counties are doing 600 mass vaccination clinics a day. We just
Okay.
don't have the capability to do that.
Sure.
So it depends on what you request. Maybe they are requesting thousands at a time.
Sure. Okay.
I was not,
No,
because I don't have the capability. What you get for that week, you have to give out that week.
oh, wow. Okay. So that's the other important part of this then. So we got 400 doses, or the hospital did. So this week you got to give out 400 doses.
400 doses.
Otherwise, the next week they're going to be like, no, you're not getting that much. Okay.
Yep.
How long is, now granted, as long as it stays frozen, it's good for
It's good. Yep.
ever, or
Forever is what they're telling us. But
okay.
the state wants you to use that allotment within a week. They don't want people to become hoarders and whatnot. Because
Sure.
once you get that first shot, that first dose, you're guaranteed the second dose. So there's no need to hoard. They want to spread it out so everyone can get vaccinated in the state of Wisconsin.
All right. Well, again, we'll just have to, and the other big part is we have to wait for the rest of the state to get to the next phase. We could get everybody done in 2 weeks, but then we would have to wait, right?
Yes. Yep. The state's only opening up phases at a time. Like now they opened up January 25th, phase B.
Okay.
So they're taking an allotment. When we open up a vial, we have to report it. Whoever we give the vaccine to, that has to be entered in the Wisconsin immunization record within 24 hours. So they're tracking it all too, to make sure that those people who are allotted are using it and giving it.
All right. Well, Angela, again, I guess that's some good news of getting those 400 doses. Again, folks can 65 and older call either clinics or even the hospital, and you can schedule that appointment this week to get that COVID-19 vaccination. Again, Angela, appreciate you joining us today.
Yeah, thanks for having me, Brian. Have a good night.
Angela Jacobson, Director of Emergency Preparedness with Advent Health. This is WRDN.